All right, guys, we finally made it. This is our last lecture, so let's dive in and knock it out. We can be done doing the video stuff. All right, our final lecture here is on the reproductive systems. Notice it's pluralized, and that's because they're two distinctly different things, male and female, that is, with different parts. Ultimately, though, both men and women are built, as far as their reproductive organs go, to produce offspring. Obviously, some people do make babies, some people don't. Some people probably do way too much of it, but that's neither here nor there. Regardless, we're all built anatomically, physiologically, in order to be able to at least do it, and at least we're supposed to. Okay? On top of that, females, you guys have the additional responsibility of developing and growing the embryos and the fetuses. So they got a lot more going on as far as responsibility goes. And even after the baby's born, we'll talk about mammary glands and how that can help support the baby after the child has been born. Men, we're pretty much built for, making the baby, and then, that's all of our reproductive responsibility. Now I won't get into actual responsibility elsewise. But anyway, sexual reproduction is a process by which organisms produce offspring. It's in a process that requires germ cells called gametes. Germ cells are a special type of cells I won't really talk about, but gametes just means sex cells. So we're talking egg for females and sperm for men. When those unite, that's what fertilization is, and that results in a single cell called a zygote. And that's how we all begin our life. When sperm and the egg unite, one cell is what that is. It then becomes two, that becomes four, and then organs start to develop and all that stuff. And here we are as full-fledged adults, ready to start a new generation. And as I've mentioned, and you guys all are aware of this, males and females have anatomically distinct organs adapted for producing these gametes, but also facilitating their fertilization, and in females sustaining the growth of the embryo and fetus. So three kind of distinctive groupings here for the organs of the reproductive systems. First are the primary sex organs, also called gonads. We've talked about these before because they produce hormones. In women, we learned about the ovaries and how they produce things like progesterone and estrogens. In men, we learned about testosterone that's produced by the testes. So we talked about these back in the endocrine system. We're going to talk about them in much greater detail here today, and more so their role in the production of those gametes, once again, sperm or eggs, depending on if you're talking men or women. Accessory reproductive organs are the substances, or are the organs that produce substances that protect the gametes and facilitate their movement. This includes ducts, which are tubes that store and transport the gametes, and then glands that secrete and produce substances that protect the gametes and facilitate their movements. And then finally, supporting structures assist in the delivery of those gametes or provide a site for the growth of the embryo and fetus during pregnancy. And men, we're talking about the penis, and females, we're talking about the uterus. Gynecology, very commonly well known branch of medicine. It is concerned with the diagnosis and treatment of diseases of the female reproductive system. Andrology is a branch of medicine dealing with male disorders, especially infertility and sexual dysfunction. A urologist, a doctor that can also diagnose and treat diseases and disorders of the male reproductive system. All right, we'll start with men, and we'll go through us, and we'll move into ladies about halfway through the lecture. Start with the testes, as we said, primary sex organs of the male reproductive system, also known as testicles, are a pair of oval glands that are the site of sperm production in men, and are the only male reproductive organ that has an endocrine function. In other words, we're talking about secreting hormones like testosterone. Their major role in reproduction is the production of male gametes, what we call spermatozoa, which is a fancy word for sperm, in a process that's called spermatogenesis. Break down that word, spermatogenesis, it literally begins with the word sperm, and then genesis just means to create or form. So that term literally means sperm formation. what's interesting, and I talked about this back when we learned about ab muscles, is that the testes actually develop in the abdomen, so they're not down in the scrotum originally, but they descend down through what's called the inguinal canal. Think back to when we talked about the abdominal muscles. Actually, I'll just pull up really quickly that lecture and show you if you forgot. That picture doesn't have it. Here we go. So there are two little holes at the bottom of the abdominal muscles, and the superficial inguinal ring here that's labeled is the opening. The canal is just the tube basically that's created by that opening. And so when the testes descend down, they go through that hole and into the scrotum. One of the first things that's checked on little baby boys after they've been born is to see if both testes have been actually have descended. Sometimes it doesn't happen. That's called cryptocortism. Cryptocortism. If I spelled that or said that correctly, which is failure of one or both testes to descend. Typically can lead to sterility, so an inability to produce viable sperm, and increases the chances of testicular cancer. And surrounding each testis is a tunica vaginalis, a serous membrane derived from the peritoneum. Remember the peritoneum we just talked about in our lecture on the digestive system, and it forms during the descent of the testes. Collection of serous fluid in tunica vaginalis is called hydrocele, which can occur due to injury of the testis or what's called the epididymis. Tunica albuginea is a dense white fibrous capsule internal to the tunica vaginalis. It encases each testis and enters each gland, producing septa, which is the plural form of septum, which divides the interior of the testes into cone-shaped lobules, which we can see here in this illustration, which is a sagittal section. Basically, it's been cut from front to back. And so surrounding the outside, tunica vaginalis, we just mentioned, and then the tunica albuginea deep to it. Notice here these little finger-like extensions of that are penetrating into the interior and kind of separating the interior of the testes into a bunch of globules, okay, just small sections. We've seen this kind of situation in many organs. Here lately, we learned that, for example, lymph nodes have an exterior capsule that penetrates inward and creates kind of channels. This is kind of the same situation. Let's see where we're at here. Within each of those lobules are what we call seminiferous tubules, a series of 1 to 3 tightly coiled tubules per lobule. And very important in that these are the site of spermatogenesis. So this is where the sperm are formed. And each of these little coiled tubes is a seminiferous tubule. That's where the sperm are produced. And several types of cells exist either within or around the seminiferous tubules. Spermatogenic. The word spermatogenic is very similar to spermatogenesis, which we learned is sperm formation. So probably is pretty obvious here that spermatogenic cells are the cells that actually form the sperm. They're the ones that go through spermatogenesis. Sertoli or sustentacular cells have several functions in supporting spermatogenesis. This was physiology. I'd get into that in a lot greater detail, but I won't. I'll just leave it as just supporting cells. And then Leydig or interstitial cells are located in the spaces between the adjacent seminiferous tubules, and they are very important because they produce the testosterone that men need. Connected to those seminiferous tubules, they're nice and coiled, are very short, what we call straight tubules. Probably called straight tubules because they are straight, okay, not coiled like we saw with the seminiferous tubules. There's one associated with each of those seminiferous tubules, which carries the sperm to this thing that kind of looks like a capillary network, which is called our rete testis. Okay. The rete testis is where the sperm goes. Okay. So reading through straight tubules, series of short ducts located at the end of the seminiferous tubules. Rete testis is a network of ducts that receive the sperm from the straight tubules. From there, we have efferent ducts, which are about 12 small efferent ductules that arise from the rete testis and carrot carry the sperm. That is not it. I won't say that. That's what these kind of longer, straighter tubules are that carry it, the sperm that is, to what's called your epididymis, if you're a man anyway. Okay? And epididymis is shown here in our picture. I really like these two pictures to show, especially this one where you can see the epididymis is kind of a distinctly separate organ. Really, it's attached to the testes, but it's kind of a separate component. And that's where the sperm go, and that's where they mature and will be stored for approximately 2 weeks. And this allows the motility of the sperm to increase. In other words, like the tail grows so it can swim and so on and so on. Okay. There are several parts to an epididymis. The tightly coiled region is known as the ductus epididymis. There's a superior portion known as the head. The narrow midpoint is the body, and the smaller inferior portion is the tail. Okay, so there's the head on top. And in the middle there's the body. Here's where you can see it's tightly coiling up. There's the ductus, and then the tail is at the bottom. And during ejaculation, smooth muscles that encircle the epididymis contract, forcing the mature sperm into what's called the ductus deferens. The ductus, or vas deferens, which is usually how I describe it, is a muscular tube that delivers the sperm to what's called our seminal vesicles. And, the duct has a very narrow lumen, as well innervated by sympathetic fibers. It's about 45 centimeters to 18 inches in length, and enters the abdominal cavity through that inguinal canal, passes around the bladder, joins with the duct from the seminal vesicles, and ends at the ejaculatory duct. So what the vas deferens or ductus deferens does is it carries the sperm up back into the abdomen through that inguinal canal that I was just kind of talking about. And it's kind of crazy, but the sperm come up and then they go around the bladder thanks to this vas deferens, and then back down, headed towards the urethra. And even though the testes are located super close to the penis, the sperm have to take a very long detour in order to get to the penis before they can be ejaculated out of the body completely. Okay. When a man wants to no longer have a baby, they have a procedure called a vasectomy, which is where this tube is basically snipped off so that the male will still ejaculate, but the thought process is that the sperm will no longer be able to go up and into the abdomen and then out through the urethra. So the term shooting blanks is what that describes. And the dilated terminal portion of the vas deferens is the ampulla. We don't have a picture of that on this page, but we'll see one here in a few slides. Sperm are also stored in the vas deferens until peristaltic contractions of smooth muscle that surrounds it forces sperm forward during ejaculation. And then finally, I want to talk about the spermatic cord, which is going to be where that vas deferens is located. It's a supporting structure. You can see it right here and over here in our real pictures from cadavers. It ascends out of the scrotum through the inguinal canal. Also within the spermatic cord, besides the vas deferens, are testicular arteries and veins, autonomic nerves, lymphatic vessels, and a muscle called the cremaster muscle, which helps to raise and lower the entire scrotum. We'll see that, I believe, on the next page in the picture. Function of the spermatic cord is just to connect the testes to our body cavity. And so, a lot going on within the testes, more so than you probably would have guessed before having seen this slide. Let's talk about other structures of the male reproductive system. Let's talk about the scrotum, which I've already mentioned. This is a sac consisting of hair and superficial fascia, hangs from the base of the penis, and this is where the testes are enclosed. Contains a vertical scrotal septum, divides the testes into the left and right compartments. Function of the scrotum is to keep the testes external to the body so that the environment of the testes is about 3 degrees Celsius below that of our body cavity. So the purpose of this is sperm actually prefer it to be a little bit cooler than the internal body temperature. And so that's why they can stay away from the thanks to some muscle that I'm going to talk about. And, two muscles that do this are the dartos muscle, which acts like a coat. And actually, the dartos muscle, let's see, I got a picture of it here. Dartos muscle is just deep to the skin of the scrotum. Okay? And when it contracts, it causes basically the scrotum to wrinkle up. Okay? So it's like putting on a heavier coat. This is what it does when it's cold, and when it's warm, it will relax. Okay? And so the scrotum will kind of stretch out a little bit more, and the wall is a little bit thinner, so it's not as hot. And the cremaster muscle was the muscle I pointed out, or I talked about on the previous page. It's located within the inguinal canal. It's what's shown right here, and it can raise the entire structure. There's one on each side, even though we don't show it on this side, but it will raise the entire structure when we're cold. It basically holds the testes a little bit closer to the body, thus keeping it a little bit warmer. And then when it's hot, that muscle will relax and keep the testes farther away from the body. Okay, we're going to talk about some glands and some ducts here. First are the seminal vesicles, a pair of glands that are posterior to the base of the urinary bladder, and they secrete an alkaline fluid that neutralizes acids of the vagina, fructose, which provides energy to the sperm, prostaglandins that contribute to sperm motility and viability, and there's even clotting proteins that cause coagulation, which is just clotting after ejaculation. Their secretions are passed through what we call seminal vesicle ducts. And in this picture, we should recognize this picture from our last lecture. This is our sagittal section. You can see I told you guys there'd be a lot more things labeled than what we saw in our last lecture. Okay. Here's our bladder, and right in kind of in behind it is one of our two, since we only have half the body, of the seminal vesicles. Okay. This creates that fluid, okay? And notice it's joining a tube, what we just talked about, the vas deferens, which carries that sperm from the epididymis up and around the bladder and back behind it, okay? And it dumps the sperm into what's called the ejaculatory duct, which I'll talk about here in a second. It's not labeled, but it would be probably a good idea to draw on an arrow right here where my pointer is and label that as the seminal vesicle duct. Okay? A seminal vesicle duct carries the fluid from the seminal vesicle, and it joins the ampulla of the ductus deferens or vas deferens, ultimately forming the ejaculatory ducts. These are, as I mentioned, formed from the union of the ducts from the seminal vesicle and the vas deferens. Each duct passes through the prostate gland and empties into the prostatic urethra. Overall, it's just a function to force that sperm into the urethra during ejaculation. So there's the duct, ejaculatory duct. Here's surrounding it, the prostate that we talked a little bit about last time. That makes this the prostatic urethra, and this continues to be the prostatic urethra, which also will receive that fluid and sperm from the seminal vesicle and the sperm from the vas deferens. Okay. Prostate, let's talk more about it. Single donut-shaped gland surrounds prostatic urethra and ejaculatory ducts immediately inferior to the urinary bladder. It secretes a milky, slightly acidic fluid in the urethra, increasing sperm motility and viability. And this is the organ that, it's a singular organ that can be kind of a troublesome organ. A lot of times in older men, it seems to kind of balloon up a little bit, and thus puts a little bit of inward pressure on the prostatic urethra. Makes it a lot more difficult to pee, because that kind of can get pinched off, and might have, you know, an effect on ejaculation. But I definitely know you hear about these commercials and stuff trying to treat this, but definitely affects urination. Prostate cancer is also a fairly common cancer as well, unfortunately, in men. All right, our next pair of glands are the bulbourethral glands or Cowper's glands, which are found at the inner end of the penis, just below the prostate, and they function to produce a clear alkaline fluid that lubricates the head of the penis, protects the sperm by neutralizing the acidity of residual urine. and they secrete mucus to lubricate the end of the penis to decrease the number of sperm damaged during ejaculation. So this is where the kind of pre-ejaculate fluid, right there. Hang on 1 second, guys. Okay, we'll start back over. Not over, but probably wasn't, or isn't the best lecture for him to jump in on. But anyway, so the pre-ejaculate fluid that comes before, the burst of semen comes from the bulbourethral glands. Now, let's talk about the urethra, something we talked about in our last lecture. Shared tube of both reproductive and urinary systems in men. Anyway, it carries urine from the bladder during urination as well as semen during ejaculation. 3 regions make it up: prostatic urethra, and then right in here is the intermediate, or also known as the membranous urethra, and then the majority of it is known as the spongy urethra. And we'll kind of talk more about the corpus spongiosum that encircles it, or that's, I guess I could say encircles it, and which is part of the penis. And speaking of the penis, it's a cylindrical organ, passes urine, and serves to deposit semen into the vagina. As far as this picture goes, you've seen it twice now, so it's probably one that you're going to see again. There's a lot going on with it. As far as things go, probably just about any and everything would be fair game, with the exception of a couple of things. The sacrum, some of us, I can't even pronounce that. I won't even try. Coccyx, rectum, those aren't things to worry about. But just about any and everything over here, some of which we haven't talked about. A lot of the things with the penis we're going to talk about on this page. Okay. Penis contains urethra, passageway for ejaculation of semen, and the excretion of urine. Cylindrical in shape and consists of kind of 3 major regions: the body or shaft, the root, and the glans penis. Body or shaft makes up the bulk of the penis. Body consists of 3 cylindrical masses of tissue: corpora cavernosa, corpus spongiosum. Okay, corpora is actually plural. Corpus is singular. Corpus spongiosum is 1. Corpora cavernosa together is 2. If we were talking about just one of these, it would be called a corpus cavernosum. And together, the 2 are the corpora cavernosa, 2 masses of tissue that fill most of the volume of the penis. And that's what this kind of area of our penis on this previous page is. Notice what it's spelled as: corpus cavernosum. Okay, here you can see the corpora are labeled as a plural form because there's 2 arrows. Okay? And then over here we can see the same thing. Okay? On the previous page, I pointed out the spongiosum, the single mass of tissue that encloses the spongy urethra. Okay, the root of the penis attaches the penis to the perineum. It consists of 2 parts: a bulb and a crura. Crura is plural, crus is singular. Bulb is the expanded portion of the base of the spongiosum. You can see the bulb right here from the spongiosum, and then you can see the cavernosa. When they taper outward, they become the crura. Okay, since one's labeled here, it's crus. Crus is singular. Crura would be plural, as I mentioned. And together, they're the 2 separated and tapered portions of the cavernosa. Okay. And then finally, the distal end of the penis is called the glans penis, and it's the enlarged end of the body. It's the end of the corpus spongiosum, and its margin is known as the corona, which happens to be a hot term anymore. Now, if a male is circumcised, they will not have what's called a prepuce. If they are uncircumcised, they would have the prepuce, which is best known as foreskin. The way the penis is supported by 2 ligaments continuous with the face of the penis, which includes a fundiform ligament. Fundiform ligament, you can see it's kind of over here in 2 parts. Rises from the inferior part of the linea alba. Remember, the linea alba is that vertical line that helps divide the abs into 2 halves. And then the suspensory ligament of the penis, which arises from the pubic symphysis, that little piece of cartilage that we've talked about which actually is shown here on this previous page. And here we can see that suspensory ligament connected to it and then connected to the penis. Got several pictures here to show various things. This is a frontal section, so essentially the top of the penis has been removed, and we can see nice interior features all the way back and even up into the bladder. Over here, we can see a frontal view or anterior view with the penis kind of been chopped off and some of the scrotal pieces dissected to see the internal pieces. This view is a posterior view to show the fact that we've got two seminal vesicles. Here we can see the vas deferens coming around, ballooning out to form the ampulla of the vas deferens. They come together and along with the seminal vesicle duct form what's called the ejaculatory duct, which dumps their secretions into the singular prostate and eventually into the prostatic urethra and then all the way down and out. Here is a picture, kind of looks like a bug always to me, but this is a cadaver penis that's been cut in a similar way like this. So for you fellas watching this might give you a little bit of nightmares, but you can really see the three different chambers of the penis as far as the cavernosa and the spongiosum with the spongy urethra inside. Okay, let's move on. Last slide here on men will be on sperm and semen. Each day, about 300 million sperm complete the process of spermatogenesis. Think about that number. 300 million is an incredible number. All it takes is one sperm to get a female pregnant. So as you can imagine, 300 million a day. We aren't getting ladies pregnant all the time. Some people never do. So for the most part, a lot of them just get, essentially wasted. Sperm itself is about 60 microns in length, contains several structures that help adapt or is adapted for reaching and penetrating an egg cell. Two principal parts make it up: the head and the tail. I bracketed off here at the bottom of the page. The head is where the nucleus is, and it contains 23 highly dense chromosomes, which is half as many as what you'd find in a normal typical cell. And that's because sperm provide half the chromosomes, egg provide the other half, and together when a zygote is formed, there are equal numbers, 23 and 23, that ultimately form 46 inside that zygote, so that a baby is born with half of their genetics from mom and half from dad. Covering the anterior 2/3 of the head is a cap-like enzyme called acrosome, and or a cap-like vesicle filled with enzymes that help it to burrow in and penetrate the egg. So that's kind of cool. Tail, as far as it's going, its job is just to help with swimming. So it helps propel the sperm during locomotion. Parts of the tail include the neck, the constricted region just behind the head, containing centrioles formed from microtubules that comprise the remainder of the tail. The middle piece is where you find mitochondria. Remember, those are the powerhouse of the cell, and thus they are where the energy comes from to help propel and power that tail. The majority of the tail is called the principal piece, and then it tapers and forms kind of a whip-like end piece. And together, sperm and seminal fluid create semen. Typical volume of that is about 2.5 to 5 mils, which is about a tablespoon at most, which is going to be per milliliter, are going to contain within each milliliter about 50 to 150 million sperm. So a whole lot. Once again, remember, only one is required to make a baby. There's a slight alkaline pH of 7.2 to 7.7 due to the secretions from the seminal vesicles. It overall provides transport medium, nutrients, and protection for the sperm, and coagulates, which we said is a fancy word for clots, after ejaculation due to clotting proteins. As far as pictures go, this one would be one you'd want to study. These over here are cadaver versions of the pictures that we really just kind of looked at. This one being the top one on that page. And then this one is the posterior view, just like this one. So it's kind of cool to see the real deal whenever possible, anyway. So there you go. All right, that's it for men. We'll spend the rest of our slides here talking about women. We'll begin with the ovaries, the primary female reproductive organs where the gametes are produced, also being the main endocrine organ or endocrine glands of the female system, secreting female sex steroids like estrogens and progesterone. As far as reproduction goes, they're the site formation and release of female gametes or ova, just a fancy word for eggs. Holding the ovaries in place are several ligaments. The broad ligament, which is a fold of the parietal peritoneum, attaches the ovaries by a double layer fold of peritoneum called mesovarium. Ovarian ligament anchors the ovaries to uterus, and the suspensory ligament attaches the ovaries to the pelvic wall. We will see some of these on this page, here and here. Some of those will be visible here on the next page. Point them out as we go through. Just like the testes, there are two tissues that cover the outside of an ovary, an outer layer of simple epithelium known as the germinal epithelium, and then the tunica albuginea, which is the fibrous layer inside the germinal epithelium. If I zoom down here, this is a picture of a frontal sectioned ovary. We can't see the albuginea, but we can see the germinal epithelium being labeled. As far as the ovaries go, there's kind of two major parts to it. The inner portion is called the ovarian medulla, and then on the outside is the ovarian cortex. Okay? The ovarian cortex is just deep to the albuginea, and these little things that look like little bubbles are ovarian follicles in stages of development. Each of those follicles contains an egg on the inside. Going through development, eventually what's going to take place is that follicle gets so big and the egg is ready to be ovulated that the bubble bursts and the egg is released into what we call the fallopian tubes. Okay? Also within the ovarian cortex, there's dense irregular connective tissue with collagen fibers and stromal cells. The medulla itself consists of loosely arranged connective tissue and contains blood vessels, lymphatic vessels, and nerves. Not a whole lot that I'm going to really kind of point out in this picture to talk about. So we'll kind of talk about this one. Kind of same thing for the reproductive, as what we did for the men. This picture we saw in our last lecture. A lot more going on with it. Pretty much any and everything will be covered. So pretty much any and everything will be fair game as far as knowing it for the exam, with the exception of like the coccyx and the rectum, the anus. But anything urinary or reproductive would definitely be fair game. This is a superior view looking down into the kind of lower end of the sorry, I'm blanking. I got my kids yelling upstairs. But anyway, looking down so we can see the uterus, the ovaries that we just talked about, some of those ligaments, round ligament, ovarian ligament, mesovarium, talked about. One thing, really the kind of main thing, something I talk about, is the location of the uterus and the bladder and the rectum with regards to one another. This is the anteriormost part of the body. These are the ab muscles. Just deep to that is the female urinary bladder. Right in behind that, posterior to that is the uterus, and then posterior to that is the rectum. So that's kind of showing you the relationship where those are all at. This is the picture just like what's shown here from the cadaver, just like I gave you for the men. And the main picture I really like to use is the picture that's on this page, where we can see the interior of things like the uterus. First, before we get to the uterus, let's talk about the uterine tubes, also known as fallopian tubes or oviducts, which are active conduits for the ovum to reach the uterus. And they are where the egg is released after fertilization. And so they carry that secondary oocyte, which is the egg that's been ovulated away from the ovary toward the uterus. 3 regions make up a uterus. The infundibulum is the very beginning of, or excuse me, I said uterus, uterine tubule. The infundibulum is the very beginning. Then you have in the middle of the ampulla, and then it narrows to form an isthmus, which is what joins with the uterus. Okay? So one of the most important regions of it is the ampulla. Why it's the longest region and why it's important is typically it's the site of fertilization by sperm. Okay? As far as the wall goes of the uterine tube, it's 3 layers thick. Serosa is a serous membrane lining the outside. In the middle is a muscularis made up of 2 smooth muscle layers, helping to push that oocyte forward through peristalsis. And then the inner mucosa, which consists of ciliated columnar epithelial cells. And the cilia use the little tiny hair-like structures to push that egg forward. There's also secretory cells that lubricate the tube and help nourish that oocyte. What we want is that fertilized egg to eventually move down into the uterus and then implant and then begin developing. Okay? When a fertilized egg, as zygote, implants in the wall of the fallopian tubes, it's called an ectopic pregnancy, and that's typically going to lead to a miscarriage. And the uterus is where we want it to go, also known as the womb, the thick muscular chamber that functions to harbor the fetus, provide a source of nutrition, and expel that fetus at the end of its development. In other words, push the baby out during childbirth. There's parts to it, just like there were parts to the uterine tubes. There's a dome-shaped superior region. We call that the fundus. Okay? The middle portion of it is called the body, and then it tapers, and that tapering portion that opens to the vagina is called the cervix. I'll talk a little bit more about the cervix here in a second. 3 layers make up the uterine wall. On the outside is the perimetrium, a serous membrane lining the outside. Myo, remember, myo always means muscle. This is the thickest layer made up of smooth muscle. That's what's all of this portion of the picture where we see. And that is made up of muscle to help with pushing the baby out. That's where those contractions that come and go as a female's giving birth or going through labor anyway. The innermost is the innermost lining of the uterus is the endometrium. There's actually 2 layers of it, the stratum functionalis and the stratum basalis. The basalis is what the functionalis is what shed each month when a female menstruates. Overall, the endometrium is highly vascular, so it's really, really full of blood flow, and it's a mucosa, so it's mucus to it. Cervix. Narrow region at the bottom of the uterus leads to the vagina. Speaking of mucus, there's lots here. Cervical mucus helps protect against bacteria that enter the uterus from the vagina. Cervical canal opens into the uterine cavity at what we call the internal os. It opens in the vagina at what we call the external os. Okay, so here's the cervical canal. Back up here, joining the body of the uterus is the internal os. Here's the external os. And this is what will dilate and open up as a female begins going through labor. I believe they say it goes from the width of a pencil, not like the length of a pencil, but like the width, all the way out to the width of the baby's head. So it can drastically open up. Several ligaments are either extensions of the parietal peritoneum or fibromuscular cords help maintain the position of the uterus. There's a pair of broad ligaments. That's what these here on both sides of our picture are showing, even though just one is labeled. There's the uterosacral ligaments, cardinal ligaments, and the round ligaments. Okay, we can't see all of them. Here's the uterosacral. You can see just one of them because of the way that the body is turned and the way the picture has kind of a weird angle. But we can see at least one of them. If we go back to the previous page, we can see some of them here, some of them here. The round ligament, the uterosacral ligament there. But like I said, this is the main image I like to point things out on. All right, the vagina, also known as birth canal, tube that allows for discharge of the menstrual fluid, receive the penis and semen, and birth of the baby. Just like we've seen in several other organs, there are rugae here, transverse folds on the inner wall. Shouldn't say vaginal, vagina. Take off the L there. Vaginal wall consists of 3 layers. Adventitious, the outer layer, holds the vagina in position. Muscularis is a middle layer consisting of 2 layers of smooth muscle, permitting expansion of the vagina during childbirth and sexual intercourse. And the mucosa is the inner layer, which has the ability to kind of kill bacteria, which is pretty cool. But also the way that the bacteria eat the glycogen that's stored here, it produces an acid solution that lubricates and protects the vaginal wall against microbial infections. A recess called the fornix, which you can see right here, is going to surround the vaginal attachment to the cervix. It happens to be where a contraceptive diaphragm would rest to prevent sperm entering the cervix. As far as the image goes, I pretty much talked about any and everything in here, so I would say make sure you know it all. All right, so let's talk about the external genitalia of a female, also known as vulva or pudendum. And there's a lot going on. In a normal semester, I would color this picture with these two pictures. Over here, this would be an external view. This would be a more internal dissected view. What we're looking at is the female perineum, with basically the female legs spread. So we can see the kind of interior of what's going on. So it's a fairly graphic image, but we're not going to color because I don't have the capability of doing so. So I'll just point things out. First thing I want to talk about is the mons pubis, shown here and over here in this picture. It's just a region of fat or adipose tissue that's above the vagina, covered with hair, and functions to cushion the pubic bone and aid in lubrication. First thing I would color are the labia majora. These big folds of tissue shown here, but not over here because they've been removed. Okay. The labia majora, labia is plural, majora is plural. If you were looking at just one, it would be labium majus. And if I go back to this picture, you can see it that way because we're only showing one because there's only half of the body there. Okay. The labia majora are a pair of thick folds of skin and adipose tissue bordering each side of the vagina. Hair, sebaceous or oil glands, and sudoriferous or sweat glands are present. Okay. Medial to those are the minora. Okay. Same thing. If it was singular, it would be labium minus. Okay. But together they secrete an oily substance, and hair would be absent. They are letter F. We would be able to color them here. And then right here in this image over here, we can color the left one completely. The right one, we can see part of it. And it's been cut away over here so we can see some of these more internal structures. The function of the minora is essentially analogous to the spongy or penile urethra in men. They can kind of engorge and tighten up during sexual intercourse and help hold the penis in there. Medial to them is what's called the frenulum, which is letter G. Letter G is this little kind of upside down V shown both here and here. And also medial to the minora is the vestibule. Okay, vestibule is letter N. This is a space, all of this area here. Okay, don't color letter O or P or D in the center there. Okay, it's all over here as well. The vestibule is just a space between the minora where we find the external urethral orifice, which is letter O, and the vaginal orifice. Okay, the external urethral orifice is the tinier upper superior opening shown here and here. The larger, which should make sense because this is where the baby would have to come through, is the vaginal orifice. Okay. Now over here in our surface view, surrounding it, we see a letter P, which is a hymen. The hymen is a thin fold of vascularized mucous membrane found within the vestibule. Function of the vestibule is to enclose the vaginal orifice, urethral opening, and ducts from the greater vestibular glands. We'll talk about those here in a minute. All right, the primary center for erotic stimulation for females is the clitoris. Structured like the penis, except there's no urinary role whatsoever, so it's entirely sensory. Just like covering the end of the male penis in an uncircumcised male, there's a prepuce, letter H, which is this kind of triangular shaped structure right in here. can see part of it over here. But the prepuce is just formed at the point where the labia minora unites. Once, kind of again, it says it covers the body of the clitoris. There's 3 regions to the clitoris. The glans clitoris is what's visible here in our surface view, and I believe is the last thing that we can color here in our surface view. It's a circular structure right here. Then you've got letter J. The letter J is the body. Okay, I'm moving through on the glans clitoris. The glans clitoris is equivalent to the glans penis in the men. Remember that is the tip of the male penis. Very sensitive because of very many tactile receptors there. The body clitoris passes anteriorly, inferior to the pubic symphysis, and then it actually forks to form a creuse clitoris. Okay? And so it forms a V and can undergo vasocongestion, which means it engorges with blood like the male penis. So here we can see letter J and then letter K here on this side, and then we can see part of it over here where we've got some of this covering it. Just the very end of it would be the creuse, okay? Just like we talked about with like the creuse stuff with the men and the penis. Vestibular bulbs, or bulbs of the vestibule, letter L would be right here and right here. Okay. 2 elongated masses of erectile tissue deep to the labia that lie on either side of the vagina. Also undergo vasocongestion, causing the vagina to tighten when stimulated, and are analogous to the spongiosum and bulb of the penis in men. The greater vestibular or Bartholin's glands, letter M. And that's why we've cut away part of the stuff over here to show it. And you can't see it over here with the vestibular bulb in the way. The gland we can now see, letter M. Opens by way of ducts in the lower vagina, functions to secrete mucus that lubricates the vestibule during intercourse. It's analogous to the bulbourethral Capras gland in men. There's also lesser vestibular glands that also open in the vestibule, but not as large, and not something we can color. Okay. Last thing, and also not something we can color, are what we call paraurethral or Skene's glands, mucus-secreting glands embedded in the wall of the urethra. That's why they're called paraurethral glands, and they are analogous to the prostate. Okay, as I just said, this picture, this area shows you the perineum of a female. Perineum is something men have as well. That's not what we see here in this picture on this page, but it's just a diamond-shaped area medial to your thigh and buttocks of both men and women, where the extra genitalia and the anus are. If I zoom in at it, you can see the nice diamond shape to it. Okay? And this is a picture from your textbook that shows those things that we just talked about, like the vestibule and the vaginal orifice and so on and so forth. I just don't really like these 2 pictures where you can kind of see them and visualize them separately with being colored. So hopefully you guys are doing so. So the main thing I want to talk about are just the kind of parts to the perineum here of a female. If this was a male, there would be a penis here, but men also have the same name for their perineum, just the male perineum instead of the female perineum. And both men and women, anteriorly it's bounded by the pubic symphysis, that little piece of cartilage between the hip bones. Posteriorly it's bounded by the coccyx, and then laterally it's formed by the ischial tuberosities of your hip bone. Okay? You draw a line straight across from the 2 ischial tuberosities one to the other. It separates that diamond into 2 triangles. The anal triangle is the posterior triangle where the anus is, and then the urogenital triangle is the anterior triangle where the urinary and genitalia structures are located. Okay? So those are the kind of main things: urogenital triangle, anal triangle. And then the very last thing I want to talk about are breasts. Hemispheric projection of variable size on the chest. Each breast is located anterior to the pec major and serratus anterior muscles, and attached to them by a layer of fascia composed of dense irregular connective tissue. Each breast has 1 nipple, and if you're talking about a female, a mammary gland. Men also have breasts, but we don't have the mammary glands, as we're all very aware. Strands of connected tissue called suspensory ligament of the breast, or Cooper's ligaments, run between the skin and fascia and help support the weight of the breast. We can see those here in this sagittal section. This is the structure that will kind of stretch out over time if a female has large breasts and doesn't do a good job of wearing a bra. Essentially keeping her breasts upright, and over time weight can just pull on that, and it's just like a waistband, it'll stretch out over time, and unfortunately that results in the breasts just, as I say, sag. All right, let's talk mammary glands. Modified through refers to wet glands, specialized for production of milk. As far as mammary glands, they consist of 15 to 20 lobes, separated by a variable amount of adipose tissue. So there's a variable amount of fat. Each lobe is composed of several smaller lobules, composed of grape-like alveoli. Now, alveoli, we recently talked about, are the little structures within our lungs where gas exchange takes place. Alveoli in the breasts are where the milk are produced. Okay? So they're bulb-shaped glands where milk is produced. Surrounding them are myoepithelial cells that contract and force the milk out into ducts towards the nipples. And speaking of those ducts, connected to the alveoli are a series of secondary tubules, okay, which then merge and form mammary ducts, which then expand slightly to form lactiferous sinuses, which are located near the nipple. The lactiferous ducts then open up into the nipple. Each nipple has about 6 to 8 of those, which makes it great for really kind of efficient secretion. So it's all in kind of one generalized area. Aside from the nipple having those openings for the lactiferous ducts, there's sebaceous glands that makes the texture of the nipple a little bit coarse. And then surrounding the nipple of vertebral size is the areola, pigmented area that is also rough due to modified sebaceous or oil glands. All right, that wraps us up. Okay, thanks guys for dealing with this, and hopefully you guys were still able to learn a lot watching these videos, and I appreciate all the hard work you guys have been putting in. So take care.